Good morning and welcome to Global Healthcast, brought to you by Global Health Press. In this podcast series, we talk once a week about globally relevant infectious diseases. I am Joe Schmitt, and with me is Dr. Melvin Sanicas. Good morning, Melvin.
Good morning, Professor Schmidt. Good morning, good afternoon, good evening, everyone, depending on where you're watching our Global Healthcast.
We have quite a few topics today. We give you COVID and monkeypox updates. We talk about antigenic sin and why vaccines may fail, natural course of COVID, rate of hybrid protection against COVID BA.5, tools to fight COVID optimal timing, and non-pharmaceutical interventions. Let's start because time is short. Melvin, what's the update on COVID?
Yes, so like what we do every week, we start with a quick global COVID epidemiology update, and we get this from the WHO COVID situation report that you can find online. And this is not real time, but this is really giving us an idea of what's happening with COVID worldwide. So globally, the number of weekly cases decreased by 15% during the week of 22nd to 28th of August as compared to the previous week. So that's good. And the number of new weekly deaths also decreased as compared to the previous week, with over 13,000 fatalities reported. That's also a good thing. Deaths and hospitalizations are still largely from the unvaccinated population or those who have been vaccinated but not yet boosted, and the immunocompromised and the older adults who have been vaccinated and not yet boosted. So that's what we have for the global COVID epi update.
Very good. So numbers are going down. The weather is cooling down here in Germany, particularly in the morning. It still gets like 30 in the afternoon, but it's cold in the morning and numbers still go down. What do you expect for autumn to come when it gets colder?
Well, that's the worrying part because we know that during the winter, other viruses are there as well. We have the influenza virus, RSV, and others. And we have been saying this since the start of the pandemic, right? That winter might be bad. But I guess the good thing is that a large part of the world has now been vaccinated or infected with some form of immunity. So I think it might not be as bad as what many people expect. But who knows, right?
Yeah.
It's always very difficult to predict the future. And I think we should not use these epi reports or modelings to predict the future because we cannot factor in human behavior.
Yeah, good point. I go to monkeypox, and there are some good news as well compared to last week.
Yes, so the WHO reported also a drop in the number of monkeypox cases reported in the week before the current week we're in, right? So cases were down 21%, while overall more than 41,000 cases already have been reported with 12 deaths. Um, so it's now not like the previous weeks when we were saying that nobody has died of monkeypox. That is not true anymore. But still, the WHO mentioned in their last press briefing that it is still possible to eliminate the outbreak in Europe. Um, we now see that cases are going down and vaccination has started in some countries for some people. And most of the deaths are actually in people who are immunocompromised or severely immunocompromised.
And here, I think from that slide you showed from compared to last week that United States cases are going down and also in France, Germany, United Kingdom. That was different when we talked last time, right?
Yes. So in the 5 countries in Europe that has the most number of cases, so we're talking about France, Germany, UK, Portugal, the Netherlands, cases are going down.
Yeah. Very nice. And actually, if you check this website here, it is really nice. You can select countries and then you can make nice comparisons.
Yes,
A great
I
website.
really love this. I really love this site.
Yeah. Now, if you are religious, you know the term sin. And the first sin ever was Adam and Eve, right? With the story with the
Yes.
apple. And what does it mean with regard to immunology? What is the immunological sin, the antigenic original sin?
Well, this is a concept that's not new for people who have been working on especially flu vaccines, right? And I have always been fascinated with this because I think it's a nice concept. And if you are a Catholic, and I'm Catholic, this is something that you can relate to because of the word sin, as you mentioned. So this is a graphic by Aaron Steckelberg, and it comes with a summary by Carolyn Johnson from the Washington Post. Basically, it just tells us the original antigenic sin or the antibody imprinting is something that we see in immune responses to many different antigens over the years. A person's first exposure to a type of virus, like let's say SARS-CoV-2, can have a noticeable or significant effect on their later response to similar ones. So let's say if you've been infected with the human non-pandemic coronaviruses, or you have been infected by MERS, your your exposure to these previous viruses will affect how you respond to SARS-CoV-2.
That is interesting. And what you see on the graph here is there is, with the initial exposure, there is a perfect match between antibody and the antigen. And if another variant comes later on, there is no good fit of the antibody with a variant. And that results in a mismatch, and you get less protection from the antibodies. Is that the interpretation of this graph? Is that what you wanted to
Yes.
say?
Yep.
Yeah.
That's it.
Yeah, perfect. So now we understand why new variants coming along, the COVID variants, you may not be as good protected as compared to the old ones. And that is also true for the different vaccines. And we will cover that again, I guess, next week. So I have one other item here on why vaccines may fail. And the mismatch is certainly one explanation, right? You already have been exposed, and the antibodies that you have are not perfect for the type of virus that is coming along. But again, there are very different reasons why and how the microbe can change. It's the match. The microbe may have a higher virulence. It may be more easy to be transmitted, and it may easier colonize you. And all this may result in a more severe pressure of the virus to infect you. And so the type of exposure, that is the second reason why vaccines may fail. The infectious pressure, this is often forgotten. I have excellent antibodies against diphtheria toxin. I'm really well protected. I received the vaccine so often in my life when I was with the German army, and I always received TD vaccine, right, at the time. So I have excellent antibodies. And if Melvin is a bad guy and he injects diphtheria toxin into my vein, I will be healthy because I have antibodies that neutralize the toxin. But if Melvin is a very bad guy, he continues to inject higher doses of the toxin. And at some point, all antibodies are gone. And then I will die from diphtheria toxin. Very simple story. People often forget that the infectious pressure is very important when it comes to infectious diseases. High pressure, more likely disease, and immunity is never 100%. At some point, the antibodies are gone. Finally, the host may play a role based on your genetic background, the number of receptors that you have. It may be underlying diseases. If you use cortisone, if you use other rituximab or any drug that affects your immune system, you may be more susceptible. And the immunity you have may not be adequate at the time you are infected. And again, functional status of the immune system, if you're malnourished, if you are, for another reason, immunosuppressed, there are very many reasons why you play a role in, while your body plays a role and your immune system plays a role in fighting infections. And finally, as you well know, there are different vaccine types, and they all provide different amount of infection, a different rate of protection. So vaccines may fail, and nothing in life is 100%. And this is just to remember what we want to achieve with COVID vaccines is not at this point disease elimination. The only thing we can do is disease control. We avoid deaths, we avoid intensive care, we avoid artificial respirators, and we avoid hospitalization to some part, not 100%, but if you're vaccinated, you have a real low chance only to get severe disease. That's my important point for today, Melvin. And I think you have now seriousness of diseases and correlation with clinical symptoms. Can you explain this?
So this is actually from the Assessment of Transmission and Contagiousness of COVID in Contacts, ATACCC study. It's a UK prospective longitudinal community cohort of contacts of newly diagnosed PCR confirmed SARS-CoV-2 index cases. So as you will see here, less than a quarter of COVID-19 cases shed infectious virus before symptom onset. And under the current 5-day self-isolation period from symptom onset, 2/3 of cases released into the community can still be infectious, but with reduced infectious viral shedding. And the findings of this really support a role for the lateral flow tests or the rapid antigen test to safely accelerate de-isolation, but not really for early diagnosis, unless this test is used daily. So maybe just to remind people how rapid lateral flow tests work, the test usually involves taking a sample from your throat and or your nose, or from your nose only using a swab. Then you get results in 10 to 30 minutes, depending on the type of the rapid lateral flow test you are using. And the test kit instructions will tell you the time you need to wait before reading your results. But basically, this is good because it tells us that these tests can be used to help people um, come out of isolation if they have tested positive.
Yeah. And everybody can use it. It's really not a big thing. You just have to read the instruction once and then you know how to do it, right? It's nothing, no secret. Everybody can do
Yes.
it. Melvin, I have another nice piece from Portugal. It is one of my favorite countries when it comes to COVID vaccination because they have a 98% vaccine uptake there. So this is really great. And they also have a very good epidemiology surveillance system. And what you can see here is since 2020 February until August 2022, they know which virus, which variant was circulating. And now what they have, and number down here you see the number of cases. Now what they did is people very likely were infected and 98% had the vaccine. Now they looked at the protection of uh, the disease of the infection in vaccinated subjects against the different variants. So if you have been infected, and then your protection rate is 51% with the Wuhan, 54 for Alpha, 61 with Delta, and here for BA2 or BA2, the protection against BA.5 is 75%. So this is much different from the opinions that are out there in the social media that the previous vaccines don't protect against BA.5. But protection is actually excellent if you have been vaccinated and then you had BA.1 or BA.2, you still have you do have an excellent protection rate. So this is very good news from Portugal, and this also is encouraging to use the new vaccines that are upcoming. Melvin, you have any other insights into this?
Oh, just to add that, I was reading about how Portugal actually reached a high vaccination coverage. So one of the good things that they have done in the country is that they recruited and trained over 5,000, influencers on social media to really provide trusted sources of information for the communities during the COVID-19 pandemic. And I think this innovative approach really helped the country achieve some of the highest COVID-19 vaccination rates in the world.
That is excellent. I didn't know that, but actually, I like to go to Portugal. First time there was 1973, and I enjoyed it very much. I'm returning frequently to
Yes,
Lisbon, particularly.
I love
So,
Portugal too. I love Portugal.
hello to our friends in Portugal. We are advertising for traveling to Portugal. Anyway, you have how to use the right tools against COVID at the right time. Why is this important, Melvin?
Yeah, this is important because I think at the moment we are in a very different situation as compared to early on in the pandemic, right? Even last year, we are, in terms of our knowledge and understanding of COVID and the virus, the disease, the vaccines, and everything else, we are in a different place. And I think this is really important because the author of this publication, Dr. Daniel Griffin, published this in the Medical Research Archives of the European Society of Medicine. And this really shows us that at the moment, we really have an updated disease framework with two preclinical periods. So we have the pre-exposure period and then the SARS-CoV-2 incubation period, followed by four clinical phases. So first, we have the early viral upper respiratory non-hypoxic phase. Then we have the early inflammatory lower respiratory hypoxic phase, followed by the secondary symptomatic phase, and then the late phase, of course. And for all these different phases, you will see the different colors below. It is important to use the right tools at the right time. For instance, you will see monoclonal antibodies, antivirals, innate immune modulators can be used in the first um, half or the first part of the whole infection course, and then in the end you will see that antivirals, immune modulators, and anticoagulation are more helpful in that specific period of your infection course of disease. So we can't be using anticoagulation, for example, in the very early part of the infection because it will not really help there. It might even worsen the disease.
Yeah. And actually, if you are in the immune phase and you add antibodies, it may not be a good idea, right? You may increase symptoms instead of decreasing them. You have to use the right tool at the right time. Nice concept. Yeah, very good. You also looked into adding rubber bands to surgical masks, and this is shown here. What is this about?
Yes, so we now know that masks work, right? That's not an issue. We also know that not all masks are the same. Um, we know that standard surgical masks are protective, but not as protective as, let's say, the N95, just because they don't seal well around the face, and they allow particles to bypass the filter because of that. So the good news is that this recent study done by researchers from the University of Pennsylvania and the University of Michigan, they published this in PLOS ONE, and they show that a simple modification to a surgical mask using rubber bands can actually improve the protective seal against particle exposure to the level of an N95 mask or a respirator. So this is good for places or countries where the supply of N95 mask is not as good as in other countries.
Yeah. I actually have a hard time wearing any mask. I have a large head and it is always painful to wear the mask. So I have a special device that is enlarging a little bit the band so that there is not so much pressure from the mask on my face. But in any event, I think if there's a lack of resources, this is something simple you can do to enhance protection. I think this is a very nice public health measure. Yeah. Thanks for showing this. And finally, you found some other exciting item. I think this is really very unbelievable. What is the story here, Melvin?
So this one was published by scientists from, again, the University of Michigan. They have been very productive in this COVID pandemic. So what they are saying here is that there may soon be a new weapon in our battle against germs in general. They have basically shown us the first durable coating that can quickly kill bacteria, as you see here on the photos, and also viruses, not seen on the photo, but they have shown that they can also eliminate SARS-CoV-2, the virus that causes COVID-19. And this coating can keep on killing them for months. So they used polyurethane to lock in the antimicrobial power of tea tree oil and cinnamon oil. And this new technology could potentially start making public spaces safer within a year. I'm thinking that this can be used in hospitals, in even in houses. You can use this in places or things that are used or touched often, right? Like doorknobs or faucets. And the good thing about this is they also show that the coating can be easily applied to any surface. You can just spray it or brush coat things to be protected from bacteria and viruses.
So very interesting. So here we have a keyboard, and each dot here is a colony of a bacterium. And here, when the surface is coated, you see much less. The same is here true for the smartphone. The same is true here for, I guess this is a plate for preparation of food. And this is, I'm not sure what this is, but it also shows that there is much less bacteria. So this is very interesting. And this is what again is the chemical?
Polyurethane.
Okay, never heard it, but I guess very interesting. So stay tuned on that one, right? It is always simple to have a good idea, but to make it happen and for available for everybody is a different story. So
Exactly.
let's follow this up. So this is interesting. All right, this I guess were all our topics today. We gave you COVID update numbers going down, monkeypox numbers go down, antigenic sin, first exposure determines how a later exposure will be protective or will change the immune response. Many reasons why vaccines may fail. The natural course of COVID we discussed, the rate of hybrid protection against COVID against BA.5, tools to fight COVID, optimal timing is necessary, and non-pharmaceutical interventions. Melvin talked about masks and service coating. And finally, Melvin, you have the cartoon of the week, the social media shortcut. What is this?
This is a popular meme from the Family Guy. It has nothing to do with the show, but just shows that in this scene where Meg, the character on top, says, "You guys always act like you're better than me." And Meg here is a non-expert personal opinion. And the funny thing, or not really funny, but maybe sometimes annoying thing, is that on social media, anyone, like literally anyone without knowledge, experience, or expertise can have an opinion, and this opinion can go viral and have lots of likes and shares, even if this opinion is actually nonsense. And people think that their opinion, because they said it and because it went viral, is much better than peer-reviewed publications, than empirical evidence, than verified facts. And yeah, this is one of the things that we live in our current world that's full of information, misinformation, and disinformation.
Yeah, very good point. Let's call it the social media shortcut, and maybe we have more about that in the future. I just submitted an article to a journal, and it is just the submission is like a 4-hour task. That is not on content, it's just a formality, right? And then you have to add the reviewers, other people who tell you why your paper is not good or why it is good, actually. So this is very painful. And the shortcut is here: I am right, and everybody else should listen to me. And that is, I guess, what is wrong here currently with the social media. Melvin, it was such a pleasure to talk to you again today. Thank you very much, everybody, for joining us on our September 7th edition of Global Healthcast number 12. Please like, share, and leave your comments below. Thanks for joining us today. I am Joe Schmitt.
And I'm Melvin Sanicas. Thank you, everyone, for listening, for joining us. Stay safe.